Okay. Thank you very much, the organizers, for inviting me. It's a pleasure to be here. For the last 2 years, I give up science and work at the university as a rector, so it's more boring work than doing the science, but somebody has to do it. So today I will talk about what I was doing still being a scientist. And for the last 3 years, we worked on the canine cognitive dysfunction, which is disease that's occurring in dogs. It's very little studied, but it's very similar in many aspects, as I will show you today, to the Alzheimer's disease in humans. As we know, and we heard during this symposium, we have several neurodegenerative diseases in humans that are quite well studied, although we still don't have many answers. But in the animals, this is more tricky. And this is also causing some problems for human studies, because laboratory rodents, they do not develop spontaneous neurodegenerative diseases. True, we have some genetic models that could mimic Alzheimer's, Parkinson's, and other neurodegenerative diseases, but I have some doubts about how suitable are these models. They're certainly, if we stick with Alzheimer's, they're certainly good models for familiar form of Alzheimer's disease, which is quite different from spontaneous form, occurs at much earlier age. And I have doubts about how well are these models representing spontaneous Alzheimer's disease in humans. In other animals, neurodegeneration is also quite rare, although it's been described in several domestic animals, horses, cats, and mostly in dogs, where it's recognized as a disease called canine cognitive dysfunction or canine cognitive decline. The brain is, of course, the most complex part of our body, and we often think of the animal brain as being much simpler. It's just a cartoon of the dog brain. Of course, this is not true. The dog brain is also quite complex structure, and we can see many parallels between human and dog brain. And this is just one example of functional magnetic resonance imaging, showing that this is after the auditory signals, and you can see the similar regions are activated in dogs and in humans upon auditory stimulations, and through could be found for many other functions. Of course, the cognitive functions are more developed in the humans, although, as we will see a little bit later, there are a lot of similarities also in the symptoms of the disease between human Alzheimer's and canine cognitive decline, which quite often people think, okay, how you can recognize Alzheimer's in dogs. The dogs don't talk, they don't show cognitive abilities, but there are actually quite a lot of similarities between the diseases. Of course, the dog brain, although the dog lifespan is much shorter than human lifespan, but still the dog brain also ages. And we can see similar aging characteristics in human brain. This is borrowed from the Hainsworth et al. Paper published in BMC Medicine, showing the brain in 4-year, 9-year, and 15-year-old dog with similar changes as in human brains. We can usually observe increased ventricles, increased sulci, and other characteristics of aging brain. However, this could also be too strong, this reduction in brain volume, increase in the volume of the ventricles, and if this happens, then we talk about canine cognitive dysfunction or canine cognitive decline. So what are the signs? They are, especially at first, very unspecific signs, and since disease, we only start to talk about this disease for the last 5-10 years, so it is very often underdiagnosed or undiagnosed, because both the owners and the veterinarians, they usually just say, okay, the dog is aging, this is just the normal aging, but we know now that it's not just the normal aging. This is the disease, recognized disease, such as Alzheimer's disease in humans. So what are the signs? Disobeying, not answering to call. Looks like that the dog is not understanding the calls any longer. Diminished cognitive abilities, like solving certain tasks, or dogs who were before doing like agility or something like that, they're not able to solve the task any longer. Loss of memory, disorientation. The dogs often stand in the flat in front of the door or in front of the wall and stare seemingly aimlessly into the wall without seeing that they want to do something. They might not find their place for sleeping. They might not find their place for food. And we have some behavioral tests, I will talk a little bit later, that could help us with the diagnosis that are based on memory and ability to find, for example, food. Obsessive leaking, changes in the behavior. Incontinence is quite common, or also the house soiling. The dogs that were previously well house trained, they start to soil at home. They don't ask to go outside. And also the changes in circadian rhythms. They could change their sleeping patterns. They could sleep during the day, and they could seem awake during the night, which could be also quite annoying because they could bark during the night. Also, the dogs that before were very quiet, they could start bark without any obvious reasons, and other changes. And all these changes are indeed, especially I said, also the disorientation and others are similar to Alzheimer's disease. In general, we group these symptoms into a group of symptoms called in English DISHAA for disorientation, which is a very common symptom. As I said, dogs cannot find their way around the flat. They also sometimes they get stuck between the furniture. They get under the table and they cannot find their way out between the chairs. Social interactions, they could be increased or decreased. They could, the dogs that were before very kind and cuddly, they could suddenly become aggressive. They could not recognize their owners. They don't want petting any longer. Change in sleep-wake cycles. As you said, house soiling, changes in learning, memory, diminished memory. Decreased activity or sometimes increased activity, but definitely change activity. And increased anxiety. So canine cognitive dysfunction, it's quite common. As I said, it's very often undiagnosed or underdiagnosed, but it is fairly common in dogs. We don't have really good epidemiological data yet because, as I said, the disease has been only recognized for the last 5 to 10 years. But there are several reports that suggest that about 15 to 20% of dogs over 8 years have this kind of cognitive dysfunction, and when we get to older age, up to 45 to 65% of dogs over 13 years. So it is a fairly common disease that is often undiagnosed. So far, we didn't find any risk factors for cognitive decline, besides, of course, age. There are several papers, several studies who looked at the possible risk factors for the disease, like breed, sex, neutering, housing, but there were no connection with the disease. It seems that it's occurring in all breeds of dogs, regardless of sex, neutering, and other external factors. So diagnosis is quite difficult, like in Alzheimer's. We don't have any blood diagnostic tests that could tell us the dog is suffering from this disease. So diagnosis is based on two paradigms. One is Cadesi questionnaire score, which is a special questionnaire with the 20 questions that we, of course, fulfill with the owner, asking about the behavior of the dog. And this questionnaire, the dog could get 1 to 5 points answering for each question, and the maximum would give 100 points. These are like questions: how often is dog soiling at home? How often gets stuck between the furniture? How often gets lost, and things like that. 100 points mean very severe. Canine cognitive decline, usually 100 points is usually it's not scored in the dogs because the dogs with such severe would get euthanized before. But we had the dogs that would score like 90 points that had severe cognitive problems. And another part of the diagnosis is behavioral tests. There are several different behavioral tests available. We used tests that are based on recognizing the food. For example, the dog is put into the room where he can smell around. He finds the dish with the food, and then he's locked out of the room for several minutes and then brought back to the room. And we monitor the time, how long, whether he's interested in food. The dog has to be hungry, and then the time that he needs to find the food again, once he knew in the room where the food was, is monitored as a sign of the cognitive abilities. But of course, the proper diagnosis could be only done after that in pathomorphology, and pathomorphological changes are quite similar to Alzheimer's disease. In humans, we can observe the reduction in brain volume in Alzheimer's patients, especially in the hippocampus, frontal and temporal atrophy, enlargement of the ventricles, enlargement of the sulci, and all of this could be observed in dogs with canine cognitive decline. And at the microscopic level, of course, we all know, we are talking about that previously, the hallmark of the Alzheimer's disease in humans is beta amyloid plaques, and this is also present in dog brain. And NFTs, neurofibrillary tangles made of tau protein deposits, are less often described in dogs. There are some studies suggesting that they are not present in the dogs, although we were able to detect some with some antibodies, and we think that maybe we just don't have good antibodies to detect these tau protein deposits. We don't have specific dog tau protein antibodies, and this could be a problem why we don't regularly see the tau protein deposits. And of course, the Alzheimer's is connected also with other pathomorphological changes, not just beta amyloid and NFTs, but also amyloid angiopathy, the position of the amyloid around the blood vessels, astrogliosis, inflammation of the brain tissue, neuron loss, oxidative damages, and damages in the vasculature, especially in the brain, blood-brain barrier. So this is brain from the aging dog. And we look at the brains of different dogs. This is, for example, 17.5, quite old for a dog, mixed breed, with clinical signs of canine cognitive decline. And with the antibodies, we could see a lot of amyloid beta deposits in the brain of this dog. We could detect amyloid plaques in different parts of the brain, in hippocampus, cerebellum, and also in the spinal cord. They are in dogs with the severe canine cognitive decline. They could be present in many different parts of the brain. Astrogliosis, this is standing for amyloid beta deposits with the immunofluorescence, with the red color. And when we stain the brain for the astrocytes, we can see that there are astrocytes present in the vicinity of this beta amyloid deposits, suggesting that there is also astrogliosis present in the in the brain of these dogs. Neurofibrillary tangles, as I said, they are not very often described. Several studies claim that they are not present in the dog brain, although we did detect some staining in the brain from our dogs at pathophysiological changes. And we think that this might be neurofibrillary tangles. They look like neurofibrillary tangles in the human brain. And as I said, the problem could be that we don't have good diagnostic tools to detect these tau protein deposits in the dog brain. And you can also see signs of the vascular damage in the brain of the dogs with canine cognitive decline, like ischemic microlesions, which are common in the patients with Alzheimer's disease. Cerebral amyloid angiopathy, deposits of the amyloid around the blood vessels, disrupted blood-brain barrier with extravasation of erythrocytes, and ischemic degeneration of the white matter and arteriosclerosis. All this could be found in the human patients and also in the brain from the dogs with canine cognitive decline. So what about the treatment? Again, similar to human Alzheimer's, of course, there is no effective treatment for the disease. There is only one drug that is registered currently in the US for treating the canine cognitive decline. This is selegiline. In different clinics, anti-inflammatory drugs are sometimes used, acetylcholinesterase inhibitors, like in human patients, which have mixed effects. Immune therapy, as in human patients, which is now becoming popular, is also being tested in dog patients, and symptomatic therapy to reduce the symptoms of the disease. However, as I said, as in humans, we currently don't have effective treatment for this disease, like in human Alzheimer's disease. Enzyme inhibitors, the most commonly in dog cognitive decline, is selegiline, monoaminoxidase B inhibitor, which is in human more often used in the Parkinson's disease. It is the only registered drug in the US. In Europe, there is no registered drug for canine cognitive decline. In the US, it is given to dogs with canine cognitive decline, but the reports report mixed effect, a little bit similar to what is happening with acetylcholinesterase inhibitors in humans. Some patients respond quite well, some mediocre, and some don't respond at all. So there are no effective treatment. However, with colleagues from the Faculty of Pharmacy at the University of Ljubljana, we were developing new class of drugs, butyrylcholinesterase inhibitors, which are very promising, although the pharmaceutical industry is not very interested because of the poor success of acetylcholinesterase inhibitors. But this colleague developed a substance that was highly effective in preclinical studies in rodents, showing quite good effect on the brain. And we tested this substance in dog's brain. It was a pilot study, small study. Actually, initially, there were more dogs recruited, but some were excluded because they had cognitive problems due to other regions, mostly other problems, mostly due to brain tumors. But at the end, we had a pilot study. This was published in 2021 with 14 dogs, which were diagnosed, went through clinical checkup, and then divided randomly into two groups, 7 dogs with receiving the treatment and 7 dogs receiving the placebo. Although it was not a blind study, this is one of the major setbacks. We would like to repeat this in a larger setup, but because this substance was completely new, it was used for the first time, and we didn't know anything about the possible effects, possible side effects. It was used in mice, but for dogs we had no idea, so we had to discuss with the owners because we cannot promise them any improvement. We cannot promise them there won't be any side effects. But the drug proved to be quite safe. Actually, 3 dogs that were initially put in the treatment group had, after 2 days of taking this drug, some vomiting and were excluded of the study. But the other 7 dogs in the treated group, they were taking daily dose of this drug. It has quite short half-life, so it has to be given daily, which was quite demanding because at the Faculty of Pharmacy, they were producing these pills, tablets by hand. And the dogs were clinically examined thoroughly with all clinical exams for the function of other organs and also with the Kadesi questionnaire and behavioral tests before the study. And you can see that before the treatment, there was no difference between the groups, both in Kadesi score and in the behavioral tests. The dogs were then followed throughout the study, and they were clinically tested and went through Kadesi questionnaire and behavioral tests at 3 months and 6 months of age. And here we can see marked difference in the group that was receiving the treatment and group without treatment with the placebo. It was a huge improvement already 3 months. There was a huge difference. This is average Kadesi score. As I said earlier, lower the score, better cognitive performance of the dogs, more overall behavior patterns. The higher the score, the worse is the situation with the canine cognitive decline. And you can see there was a huge statistically significant difference. And this difference became even larger at 6 months of age. Here, however, we do not have standard error bars, if you noticed, and that is because in the control group, only 2 dogs were still, out of 7, were still alive after 6 months. In all the other 5 dogs, the disease progressed so rapidly, so severely, that they have to be euthanized because it was very difficult for the dogs. They were suffering from the disease. And in the treated group, all 7 dogs were still alive and much improved condition. And similar on the behavioral tests, you can see the large difference already at 3 months and even a similar difference at 6 months of age. This is just a diagram showing individual dogs, how they behave. This is the starting Kadesi score. And you can see that in all dogs in red that were in control group, didn't receiving the treatment with butyrylcholinesterase inhibitors, their status declined on Kadesi score. Only 2 survived to 6 months of age. And in the treated group, all the situation with all dogs improved. They were much better, especially at 6 months of age, but also already at 3 months of age, suggesting that the drug was really effective. After we stopped the study at 6 months of age, because we cannot afford it financially, we didn't have any special large grant to do this study. The condition of the dogs that we followed deteriorated rapidly. It was not a very good situation. The owners were quite unhappy, but we weren't able to produce the drug any longer. And as I said, we would like to do a larger clinical study, blinded placebo. We were talking with some companies about taking over the patent. The drug is patented, but they want to see the larger clinical study because they would enter into and so now we're in this valley of death, as it's usually said for the inventions, the TRL 3 to 6, when you have a good concept, but you don't have enough proof that the industry would become interested in investing in that. So at the end, canine cognitive decline is very interesting disease, I think, from 2 points of view. From the point of view of veterinary medicine, it's interesting to study how we could help the dogs, because as in human patients, the disease is very debilitating for the owners of the dogs. Living with the dogs with such problems could be very hard, and the dogs are usually within a few months after being diagnosed, euthanized, because the life becomes too hard with them, and it's uncomfortable for the dogs as well. But on the other hand, I think it's a very interesting model for studying human Alzheimer's disease, because, as I said at the beginning, we do not have natural models, other natural models of neurodegenerative diseases. The mice, in my opinion, are not such a good model, and the dogs could really provide valuable in studying mechanisms that lead to development of Alzheimer's disease, but also in testing possible new drugs. At the end, I would just like to acknowledge people who were involved in this study: Sonia Perper-Michevc, who left the science and is now working in the pharmacy; Maja Zakošek-Pipan, the clinician who did all the clinical work. She's still involved in that. We're just now waiting for the results of the grant that we could continue with some of these studies. Milan Štrbinc and Daria Paulin helped with the studies at veterinary faculty. And Stanko Gobec, Urban Košak were the main people at the Faculty of Pharmacy working on this. And we collaborate also with Boris Rogel, who is also here from the Faculty of Chemistry and Institute Josef Stefan. So thank you very much. So I would conclude, and I would be happy to take any questions.